Hello, everyone. Welcome to another edition of Through a Therapist's Eyes. I am used to saying I am Chris Gazdick and he is Craig Graves, but if you have been following us a little bit, you know that we have a bit of a transition at Through a Therapist's Eyes. We're going to be doing, officially starting today, co-hosts with the show, and they're generally going to be taking a month on, and we'll hang out with them, and then we'll transition to another one. But today we've got a one-time special because honestly, Kasie, I feel like for this one, I needed two heads on this one. This is hormones and mental health therapy. And by the way, you're not a boy, right?
That would be correct.
Right. Neil, she's a girl, and that's important for this episode as well, right? So anyway, more on that in a little bit. I have a book out and about. I understand kind of doing some scavenger hunt for all you people out there. I'd like you to go to bookstores and see if you can find it in the bookstore and let us know. I'm just kind of curious at how this process goes. I had somebody that found this book, actually, Kasie, a buddy of mine. His kid went to become a Marine, and he was on the island of Hawaii, is where he's based. He walks in and he sees the book.
That's amazing.
Yeah. I was really tripping out. I was like,
that's so cool.
Oh my gosh. It's in Hawaii at a bookstore. So that's pretty cool. Re-understanding emotions and becoming your best self. Check out our website, throughatherapist'seyes.com. You really want to on this one because we do put show notes on there. And actually, I got a lot of articles that I kind of popped into this show prep because little foreshadowing, we don't know crap about hormones. Would you agree, Kasie?
I definitely agree.
Seriously, it's like...
It really is just a confuddled mess of lots of people giving opinions about how things work.
And I love the word confuddled. That's an awesome word. Nicely done. So what else to say? We have BetterHelp.com, or not BetterHelp.com. Go to our page, throughatherapist'seyes.com. Click on the counseling tab. It clicks you up with BetterHelp. Helps support the show, and you get therapy in your own home. And I believe in online video conferencing. We've been doing that with the pandemic since the beginning of the pandemic, I should say, through the pandemic. And I even talk therapy on the telephone. I've curious, Kasie, I've never thought that was effective. I would refuse to do it.
Yeah, I used to have the same kind of stigma around it, but I'm going to tell you, just being able to be in your most comfortable place and your most comfortable space and talking through your emotional understanding, there's something therapeutic about it. So right. I'm really a fan.
I would refuse to do it, but so check it out, and it's a good way to help the show. They support us when we get a referral over to them. So this is the human emotional experience. Kasie, let's figure this thing out together. What do you think?
I think that sometimes we have more questions than answers, but we should get started.
This will definitely be one where we do. I can guarantee you that. So before we do, tell us a little bit about you, just as far as, the co-host and what you bring to the show, what you're thinking about. I know that you're an awesome therapist. Your schedule, actually, as a matter of fact, we have a lot of local listeners. You are going to be fired up, oh my gosh, in like a day or two, right?
Yeah. So beginning June 1st, my schedule is completely open. I have opened up 36 spaces. So get on it is how I feel about that. I am really excited to be coming on full-time at Metrolina and really being able to kind of have some positive change in the emotional growth in the surrounding area, but also by virtual. So if you aren't local and still want to connect virtually, you can also call into the office and get on the schedule as well. So
you got to be in-state.
Yeah, you do have to be in
North
state.
Carolina.
Yes, sorry for that qualifier. I forgot that we have out-of-state listeners and even international listeners. That's amazing.
We're shooting you out around the world right now, girl.
Yeah, I love that.
Can you handle that?
Yeah, I do. But yeah, I'm looking forward to making some guest appearances on the show and kind of imparting some knowledge. My kind of place of orientation kind of comes from some resiliency training, which is really important to me. So I think that's cool.
What do you do for fun?
Oh, wow. I love to read. I know that sounds really kind of lame. It sounds
that's
boring,
not
but
fun.
It is fun to me. But anything I can do outside with my kids is always fun with me. So if it's just randomly throwing a water hose in the yard, I like to do that. I like to sit on my porch. I love fire tables. I love movies, especially outdoor movies. If that's an option, that's always my option.
She's got the coolest shirt on right now. It says, "Talk to me, Goose."
Talk to me, Goose. Yeah. I love Top Gun. I like movies for guys who like movies.
I think that's awesome. So I have, and I did. I kind of pulled you in on this one, particularly thinking multiple things that I told you before the mics come on. But I really feel like this topic area needs two heads on this for sure. And so it'll be cool to have two clinical heads. As you know, Kasie, we generally have people that don't come from a mental health background. This one with hormones, I don't know. I'll be curious to see what we get coming back and forth with this. So I have a developing belief that I really am curious about what you think about. Partly it comes from listening to Neil deGrasse Tyson. Man, he's awesome.
Yeah.
And he was asked a question one time. What's the newest type of stuff? I forget the exact question, but the most interesting area of exploration. Like, what are we really needing to and getting ready to dig into? And you'd think he's talking about like, wow, black holes or dark matter and what dark matter's role is in the universe and these kind of crazy. No, you know what he said? Neurology. He said neurology.
Yeah.
There are as many neurons in our brain as there are stars in the sky. And that's the type of systems that we're going to be talking about when we say, how do hormones affect mental health? This is dynamically interesting insofar as the newest. And I feel like this is the new frontier for mental health.
I 100% agree. I really believe that, when people approach mental health, they often think about it as like mental weakness. But a lot of times it's honestly, Chris, a biological process of the body that is being activated through the nervous system. And so neurology being that frontier, that makes a lot of sense. It makes a lot of sense to me.
I call it the tale of two tapes. I almost say this every initial appointment. An overview of mental health. On the one side, you have, biology, exercise, nutrition, all of that, but your neurotransmitters, your hormones. I don't really talk about that per se, but what you've got going on genetically is ingrained in your body and how you feel. And then on the other side is the social and emotional reality, life experiences, primary, life's relationships, the daily grind, stress, all of that kind of such, right? They combine dynamically, and we're talking about this side, and we're talking about a completely part of this side being the medical, the biological, that we don't really know a lot about. And that's so some of what you're going to hear today is me kicking around my theories in some ways. Actually, John Pope, our guy, he called me a theorist the other day.
Look at you.
He really did.
That's a pretty fancy word to throw out there.
I thought so. I was like, I never thought of myself as a theorist, but
Chris the theorist.
Right?
Plastic. Yeah.
What is that? But it's true. I'm going to be thinking about these things in that way. So let's dive in. We got a lot to cover. What are hormones? Okay, from an article. This is one that you want to set out and check out on newsmedical.net. I thought they'd nailed it down pretty easily. Chemical messengers that are secretly secreted directly, not secretly. I guess they are secretly secreted. Secretly secreted. Can you say that 3 times?
I cannot.
Try. It'll be great.
Secretly secreted. No.
Oh, wow. She was going good, though. She was going good. Clinical messengers that are secreted directly into the blood, which carries them to organs and tissues of the body to exert their functions. There are many types of hormones that act on different aspects of bodily functions and processes. Right? Some of these include development and growth, metabolism of food items, sexual function and reproductive growth and health, cognitive function and mood. They say, and by the way, and mood, right? Like, holy crap. Maintenance of body temperature and thirst, and they are secreted from various organs throughout the body, interestingly enough. Just stop there for a minute and think of all of the, like, do you know where they come from, hormones? I literally kind of thought they were from the brain primarily, but they are all over the place in the way that they're coming. Stomach creates, hormones. Our kidneys create hormones. Our, the limbic system, of course, in the brain. Do you realize how many places the hormones actually get secreted from? Did you realize that?
No, honestly, when you were saying that, I was just thinking, like, isn't it the pituitary gland? Isn't that like one of the major things? And like, that's all I learned in school for sure. That, you go through the changes of life in an adolescent, and then your pituitary gland pumps out some hormones, and then you go through puberty. That's basically my rudimentary understanding before I became like a mom of what hormones were. Yeah.
And, honestly, audience, I want to tell you, I have a lot of respect insofar as Kasie's intelligence on all of this. And I just don't think clinicians alike, we have any idea what all of this does or is. Like, it is not in our clinical rooms very much, like, at all. Would you agree with that?
Oh, I definitely agree, because in formal training, we talk about the functional model, right? Like, where are you in your life right now and where do you want to be? And that's what we help kind of develop goals around, right? So like we talk a lot about that functional model of how to get to where you want to be and the emotional growth side of things. We don't really focus intently on the medical model or the biological processes that aren't relevant to kind of the patients that we see. So it's interesting.
And there's on this article, I've got, the liver that's creating hormones, the thalamus, in the center of our chest and the sternum, right? Our pancreas, that's, insulin, right? That's a hormone,
Yeah.
right? A big one, and I'm sure that you've dealt with, the thyroid in therapy. I've learned from my clients that, the thyroid gland is a very important medical function as far as mental health goes, right? Depression and all that comes out from that. That's in our throat. I mean, this stuff is all over the place is the point that I'm really trying to make. All over your body. And I tell you, if something is produced, I believe for all kinds of people, it can be misproduced. Now, let me say that again. That's a takeaway, if you will. I believe if hormones are produced, they can very easily be misproduced. Overproduction or underproduction by just little minuscule amounts will make a huge difference in how you feel, either physically and certainly emotionally when it comes to depression, anxiety. We'll get into it, but this is dynamic.
Yeah. I mean, honestly, when people come to my office and they want to talk about the medication discussion sometimes, the first thing I ask them is, when was your last blood draw or physical appointment? Because there is so much that can be told by the chemistry, the chemicals present already in the body, that you have to kind of get a check on those things because of all those organs that are producing those hormones and imbalances in the body that really are not just as a result of an organic, like, mental health condition. So,
let me jump in because I'll tell you, I have found and learned a lot about this because I've been paying attention for the last several years in my interests in neurology for sure. And, look, there's a problem. I'm not a doctor. I'm not an endocrinologist. I'm not, I'm just some lowly therapist guy who's geeky and likes to listen to Neil deGrasse Tyson, right? But I have learned that your hormone fluctuations are daily, hourly, oftentimes, this is important, oftentimes momentarily, right? And all you have to know is when you go down the street and you're driving and you see blue lights in your car, what do you think happens to your hormone system?
Yeah, it's like a fire alarm.
Right? That is now.
Yeah.
And the same thing happens when your husband says something that you don't like. Or when your kid comes home and makes you maddeningly emotional, right?
Yeah.
So if you're going to do testing for hormones, the endocrinologists are probably the leaders in this. They will tell you, you really pretty much need to get morning, noon, and night for however many days to kind of get readings of fluctuations in addition to just simply a total. Like, it drives me nuts the way that we do hormone testing. Pop in, oh, you're in average levels, you're in good shape. See you later. Like, no, that doesn't work. That literally is a disservice. And that's basically all the testing is at this point. Does that sound correct?
Oh, that's absolutely correct. They do one panel. They measure like 26 things on one panel, and then they come back and tell you, if you're high or low or within normal limits, even if within normal limits is like 1 point away from being too low or too high.
Right.
Yeah.
That's it. They look at it. They look at your blood. They look at a chart, and they tell you, check you later.
Correct.
Like, that is really. I'm gonna make the statement. I'm gonna make the bold statement that is so inadequate when it comes to this issue with people that are dealing, especially with hormone-related mental health.
Absolutely. And what they don't ask, which is what I think us as therapists and other mental health-related professions, is they don't ask, what does your day-to-day look like, in addition to looking at your blood? So, like, they look at those blood panels, you're like within normal limits, but on the low side or the high side, but they're not asking the tough questions. Like, what's going on in your life? At my age, like approaching 40, it's kind of like I'm getting ready to venture into the aging parent category, right?
Ooh.
And so but I mean, people don't always ask those questions, right? And so I think that's another important part of the conversation, exactly what you were saying before. So we have this organic stuff going on, and then one thing happens, like one stressor changes, but they're not measuring that again until next year when we go for our physical and have a blood draw.
Right.
Yeah.
How many hormones do we have? Do you have any idea?
I'm going to go with 41. It's my favorite Dave Matthews Band song.
Wow. Again, we need to hang out and listen to music and watch some movies, Kasie. I'm going to go with for it. No, that's incorrect.
Okay.
I'm going to try to give this brief. We have so much to cover, but I'm going to try to give the brief here on answering this question because it's important and it sets up what we talked about. And for those that listen to the show regularly, you may have heard this story already, but I really need to put it into the context of this show. And I really want you to go back and type in the search bar on our website, Gwen Wild. She was on our show as really fast. She's an occupational therapist, Kasie, but I feel like she's an authority on neurology.
That's awesome.
Really. I was wildly impressed with her, and I went to a training with her, and I was like enthralled the entire time. I was not bored for 1 minute.
That's impressive.
Right. That you know this.
Yeah.
You know this at this point in our careers. So, okay, Dr. Google, if you Google this, it will make your head hurt, right? Like, they list things like the 5 female hormones. They list things like the 7 different types of hormones. They say, one list had vitamin D as a hormone, by the way. I'm like...
Is that real life?
Is vitamin D a hormone? I
thought it was a deficiency.
Right. Well, it is a vitamin.
And a vitamin. Yeah.
You know, I don't know. What the hell's, you know? So I waited, like literally in my career, like 10 years to go back to a neurology conference. You've been to these conferences.
Oh, yeah. I love
Here's
them.
the cerebellum. Here's the limbic system. Here's the whatever.
Corpus callosum.
Oh, that's a good one. That's a good one. I always go with cerebellum, but the corpus callosum is a good one too. Right?
Yeah.
Okay. As I got frustrated with this in the morning. And so we're getting ready for lunch, and I'm standing up in the back because I just can't sit down the whole time. And I raise my hand up because I asked him, and he looks at me. He's like, yes, sir. What you thinking? You have a question? Yes, sir. So I'm like, well, so do we have an understanding of, you know, I'm hoping in this conference today we can get to like how this affects people with anxiety. What happens in our therapy office, right? Like, you know, with the neurology that you're talking about, the neurotransmitters and all this, and you know how that interacts with people. Like, can we talk about that, or do we know much about how individual, you know, hormones affect the body? He's like, well, I'm not sure what you mean. I said, well, okay. I said, do we know who all the players are, right? Like, do we know what hormones doing what with different diagnostics and different experiences? And he's like, well, it seems like you've got some questions. You just see me on the break, right? And come talk. And I said, oh, wait. I said, well, let me try one more time. I said, do we know how many hormones are in our body? The room groaned, Kasie. The room was like, you know, when he said, oh, I have no idea how to answer that. I was like, really? That tells me all I need to know, right?
Wow.
Because he did go on and he said, we have hundreds of hormones in our body and hundreds of subsets of each hormone in our body.
So not 41.
Definitely not 41.
Yeah.
Definitely not 41. Subsets of each hormone. You know, plus you throw into this the idea that we have like over 60 neurotransmitters or whatnot. Gwen taught us that on the show, and which we've only named about like 12 or 15 of them because the other ones are so small and moving around. You throw in rocks and minerals and vitamin D, right? Do we have any idea the dynamic nature of how all of that's operating in our body?
I honestly don't think so.
Right?
Yeah.
I mean, subset testosterone 53 mixed with subset adrenal gland, number 12, and melatonin subset 57 mixed with vitamin D deficiency. Tell me about that, Doc. What's that say?
You're not sleeping very well.
Right. Right? Now, the good news is we're learning. We are so learning. But this is why I say this is on the frontier for our field. Like, if we practice long enough, we may get a little bit more information, but our kids that are practicing are going to, like, really be on the handle for what our bodies are doing when it's doing it. And we're going to have answers. I believe that. I believe we're going to have answers. But right now, we are struggling, okay? We are struggling at best. So, really quickly, one of the ideas that hormones affects mental health would definitely be with... You're a girl, right?
I am a girl.
Menstrual cycles.
fun.
All the man hating just like clipping right now. He's like, he has no idea what the heck he's talking about. Why are we talking about menstrual cycles in therapy?
Like,
You've got to be kidding me.
Are you about to mansplain the vagina? That's what I want to know.
No.
Okay.
All right, I just got uncomfortable, Neil.
Sorry.
Mansplain the vagina. I know nothing, but I do know through, actually, our colleague of mine definitely taught me this about 10 years ago. She made just a passing comment. You know, I do not do this in therapy. Honestly, I haven't. I still, because I'm a dude, I will talk about the cycles and everything for sure. But she will go out directly and really kind of say, as a bit of a standard, right? You know, you cannot be dealing with intently triggering mental health realities or emotional dynamics in a relationship when you're in your menstrual cycle. It is not wise. Fair?
Fair.
Do you deal with that or talk to people about that? And is that an open, how do you deal with that?
Yeah, I definitely do discuss that. Especially if they come in or request an appointment in between regularly scheduled appointments, the first thing I say is, when was your last period? And we kind of have an open and honest, real conversation about it because of exactly what Allison has expressed. You making emotional, rational decisions during a period of time when there is a fluctuation of hormones in your body is...
You don't have a chance.
You don't. And neither does the person that is the target
Us.
of those things.
The guy. Right.
Right.
And furthermore, for guys listening out there, you correct me if I'm wrong, but I have talked to women about this in therapy, particularly when we come up and we talk about premenstrual dysphoric disorder. We're going to talk about that a little bit. Women, would you say, again, it's part of the reason why I got you here today, because you're a girl, I'm a guy, right?
Mm-hmm.
I am amazed as a boy that women tend to very much not be in tune with their cycles. They are not aware a lot of times of what's going on. And I'm not talking about just teenagers. I'm talking about 40-somethings and whatnot. Would you say that that's a fair assessment in the generalization?
Yeah. I mean, in the generalization, I do think it's fair. I think the other side of that is, though, that, as a society in general, we kind of have generalized what that cycle has to look like. And so there's these rash assumptions that oh, if you're moody, it's because you're getting ready to start your cycle. Oh, if you're having these food cravings or unexplainable weight gain, it might be because you're about to start your cycle. And so we've kind of even desensitized ourselves to thinking that there could be something wrong with our chemistry in our body, that it might not just be related to just going through our menstrual cycle. It could be related into things that are surrounding that, like hormone fluctuation. And so
that's what I'm getting at.
Right. But we're just desensitized to it, because if you call in to the office and you're like, hey, doc, this is how I'm feeling. They're like, oh, well, you're about 4 days out of your menstrual cycle. It's probably this. And you're like, oh, okay. And you're just expected to pick up and move on and being okay with that answer.
Right. And I think by the time a woman is 23, they're just like, whatever, man.
Yeah. I'm having my cycle every 40 days out of every 60. It's fine. And you're like, what?
It makes me insanely frustrated.
Right.
It really does. Because I think particularly women, have been absolutely thwarted by the medical community in these issues. And we'll come more to that, later. But instead of dealing with the emotional triggering realities, I would really maintain that this is a time to be extra nice to yourself. You've got to take care, knowing what is fluctuating. Take care of yourself. It's not the time to do extra. It's time to kind of really chill, I would say. Sound fair?
I think that sounds very idealistic.
Wow. I did not expect that response.
Yeah.
Who had her on the show? Who was that?
No.
What do you mean? Explain. I'm curious.
No, I do. I mean, I think it sounds idealistic, but I think even thinking about and I'm not every woman, but I represent a vast majority of women my age, typical person. And I think that I would love the opportunity to take care of myself, but I also have kids at home and a husband at home and other responsibilities.
Oh, I see what you're saying. Sure.
So it's hard to sit there and think about sometimes taking care of myself. And I know that this is something I often talk about with people in my office, kind of that guilt that surrounds doing something solely to be relaxed when there are other responsibilities.
No, absolutely. I totally get your response now. I understand. Matter of fact, that's one of the big reasons why I talk about the lost decade.
Yeah.
Excuse me. I did a show on that. And that's one that I want to redo. Maybe we'll redo that one with you, actually, because I'd be very curious. I will. As a matter of fact, I'll make a mental note.
Because we're a decade apart in age? Or?
No. Oh, my God. Did she go there? Did she go there? Dang.
Bazinga.
Wow. It is close. It is close. Anyway, we're in the same decade. How about if I say that?
Okay, that's fine.
But listen, hold up now. This isn't all about women.
No.
This is not at all about women. Dudes, you got hormones as well. As a matter of fact, I recently learned, maybe about 4 years ago, as recently in my career, I have estrogen in me. Like, that's not cool.
You also have breast tissue.
That is not cool either. At all.
You can get breast cancer.
Right?
Yeah.
You got to squeeze my little things? Oh, this is getting scary. But no, we really do. This is a reality that men do not deal with at all. We're completely blindsided when you talk about hormones, and I've seen this in thyroid issues for people. I've had people that long-term depression, thyroid, and they're talking about their hormones and dealing with stuff. But even just that, like women, men experience hormonal shifts and changes every day. Our testosterone levels rise in the morning and fall in the evening. I didn't know that. In the morning, it's higher. In the evening, it's lower, right? So they can vary from day to day as well. You might have one big up day and one, down day. This is why sex drive changes. Men aren't horny all the time. It's like, a myth. There are men sometimes that just have no sex drive in my office, from what I see, And so this is not just a female issue at all. Can I blow up that myth?
Yeah, go for it.
Right? I'm doing my best because it is we think of menstrual cycles, we think of menopause, we think of these types of things. We think of hormones as a woman problem. Go fix your problem. Well, we're going to talk about it later maybe. What about hair loss? What do you think causes hair loss?
I'm going to go on a limb and say hormones.
Boom! How many hormones affect hair loss?
41.
There you go. I set you up for that. I set you up for that one perfectly. Symptoms of male hormone imbalance, right? Cognitive decline, depression, erectile dysfunction, fatigue, hair loss, loss of muscle mass, low sex drive, memory loss, right? That's a lot of what women go through.
Oh, yeah.
I would submit.
But don't you think it's far more stigmatizing for a male to come forward and be like, I think I'm having a hormone issue?
Oh, like I'm not going to say that ever in my life.
Exactly.
Never.
Right.
No.
Like you're not going to the doctor because you feel like you have a hormone problem.
I have no hormone problems.
Right. You're like, I actually have to have feelings for me to feel them. Yeah.
It's terrible because it's very real, And when your body's going through something and then you feel all alone with it. So part of what I'd like to have with this show is to help people understand, like, we're not alone dealing with these dynamic issues and whatnot, for sure. Let's focus on one hormone, particularly cortisol. Right? So let's keep it simple. If it's produced, then it can be misproduced. Oh, I said that all earlier. That was one of the points I wanted to make.
Right.
My questions revolve around what is the mental health effect of this, right? Blood levels of cortisol vary through the day, but generally are higher in the morning when we wake up and then fall through the day. What is that? That's a commonality. I didn't even realize that when I was on my show prep.
Yeah.
Testosterone and hormone of cortisol.
Yeah.
Higher in the morning, lower in the evening. There's got to be something behind that. That's got to be something. Anyway, that's just side note. Ooh, this is called a diurnal rhythm. Diurnal.
Diurnal. Yeah.
Is it diurnal?
Yes.
Diural. Diurnal rhythm. Who
On
knew?
both sides of the day.
Right.
Yeah.
Very cool. In people that work at night, this pattern is reversed, so the timing of cortisol release is clearly linked to daily activity patterns. In addition to response to stress, extra cortisol is released to help body to respond appropriately. So let's theorize for a second, right? Like,
yeah.
If that's the case, okay, what's causing the systems in our body to do that, and how does that affect the way that we feel? Like the blue lights, like triggering trauma memories, like all sorts of things, right?
I have a theory.
Okay, what's that?
So
I love it.
I think that, especially the working population of the world or anybody that has like kids at home, whatever your job is, because all jobs are valid. I think you wake up in the morning, right? And your nervous system is at baseline. The closer you get to your job, what you're working, whatever's going on during that period of the day, that activation begins. And if it is stress inducing, then you're producing an overproduction of the cortisol hormone, which is going to be that stress related hormone. And so then as the workday declines and you're getting ready to go home, you're feeling better, you're feeling more like relaxed into the work, or you're like, hey, okay, I'm getting ready to go home. And then you get home. I'm almost wondering if more research should be done about like, okay, so it declines a little bit in the evening, but then once like you get to the threshold of your house, does it shoot up a little bit when you switch roles again and then
the kids
decline
are
when
home.
Exactly.
Right?
Yeah. So I think it's probably age dependent, situation dependent as well. But that would be my theory, is that as the nervous system fluctuates between like, not to get all brainy, but like parasympathetic and sympathetic nervous system, which keeps us regulated, are those hormones fluctuating within that because of whatever stimulus is next, like what's coming next in that anticipation?
Neil, I can guarantee you when I come home, my hormones go up. he's smiling. We talk about our kids often. Yeah. Yeah, that's perfect. I mean, I think that's dead on. I feel like that has a lot of meat to that. And, smarter people than anybody in this room is going to have to come to answers to kind of look at, but my question actually even is, judging by the neurology conferences I go to, is anybody researching that?
Sure.
I'm probably, but I don't think from a mental health perspective, I would bet not.
Yeah. I mean, that would take a lot of crossover, right? Like if you really think
a lot of
about
crossover.
The pendulum of health in general, right? It used to be two completely separate models of health. You had medical model, medical biological model, and then you had functional model of health. And behavioral health was always, and mental health was always categorized just in that functional model. We didn't cross over to the medical side, and doctors didn't cross over with us. And now what we see is a complete swing of that pendulum when we talk about integrative care, where, doctors and mental health providers are now recognizing the importance of both and really trying to encapsulate that under the umbrella of overall health. If you have high blood pressure, you go to the doctor to get a statin medication to bring down your blood pressure.
Right.
If you have high anxiety, why is it not normalized to go to the doctor and talk about getting something to help bring down your levels of anxiety? And so I think that's kind of where we're at right now, is we've seen the crossover of the concepts from like a medication perspective. But what we haven't seen is a crossover of that research perspective, where it's taking the cross section of what is going on biologically in a person's body in comparison to what is happening on a functional day-to-day basis to that individual.
Right. And I guess as you were talking there, like I'm seeing different factors, because I've been paying attention to this probably for, the last better part of the decade.
Yeah.
And that's about the time that I went back to that neurology conference, several years ago in the middle of that. And I think they're looking at it medically. I really think they're looking at it and getting all kind of crazy diagnosis for the medical world, but they're not looking at how that goes into borderline personality disorder.
Right.
Ooh, that's a little bit of a foreshadow.
Sure.
They're not looking at it when it comes to bipolar or anxiety conditions, as you say. They're not really looking at what are these systems and how can we manage them. And that goes way beyond neurotransmitters. Like that's all we give medications for. Medications for neurotransmitters and mental health. We haven't done anything for, 25 years different, right?
Oh, yeah. And I think as a society and as a whole, we have tried to hold on to these like fad recommendations on how to help your hormones, right? So like, and I'm in no way am I knocking any of these practices, but because we haven't had
faddish recommendations.
Yeah.
I'm curious.
I'm not knocking any of these recommendations, but because we don't have succinct answers, we've reached out for like essential oils or supplements or different things to put into our body to help regulate these systems.
Thought you were going there.
To try to make us feel better. And then sometimes it kind of works, but I can even speak from a personal example. Like I wrecked my hormones and metabolism by doing intermittent fasting because I didn't do it under the direction of my doctor. I did it on my own accord by researching it myself on Dr. Google. Like,
Right.
why would I not? You know,
Of course.
it was something that I had read about, saw an ad for, and thought, hey, that might be something I can do. I don't like to eat breakfast anyway, you know, and
Right.
things like that. And then when I went to an endocrinologist to try to get a weight management plan, they were like, girl, you wrecked yourself, because I killed literally the remaining metabolism that I had.
Wow.
Because I wrecked all of my hormones by throwing off all of my food mineral assumption, like consumption and absorption, all of that, just by participating in a behavior that I thought may help me out, because
That's
there
interesting.
isn't a lot of research out there about the cross-sectional kind of things that go on in those things. So
Yeah, in keto diet, we did a show on keto diet
Yeah.
where somebody shared, that we know, she shared a dramatic first time in her life ever absolution of her experience of anxiety. It was really cool.
yeah,
Now that's a good sign, for her. But intermittent fasting, like Craig loves those things. He
Sure.
researches all those things, and I'm glad you qualified it, because those are great tools.
they are.
But they're not really, quite possibly, I hear you saying, understood.
No, and they're not one size fits all.
Right.
And I think that that's the part too, is that
Right.
we see it work for all these other people. We think it was going to work for me, but we're not paying attention, like you said earlier, to our own kind of behavioral markers or things that are going on within our bodies, because we're not really taught to do that. We just explain it away. So that's why this show and other things that bring light to this subject matter are so vitally important.
So let's transition and talk about, the genesis of this show? It was that email we got the other day,
Yeah.
right?
Yeah.
You remember that email?
I do.
I'm gonna be humble and genuine with people right now. We got this article, this referral, and I totally had to look it up. I did not know what that diagnosis even was.
Yeah.
Did you know?
What, DMDD?
Yeah.
Disruptive mood dysregulation disorder?
Right. Oh,
Yeah.
God. Say that 3 times.
Yeah, disruptive mood dysregulation disorder.
That's only once, but we'll stay there.
Yeah, a little.
Right. I had to look that up. I've never diagnosed that.
Yeah.
I did not diagnose it, and I was surprised at myself in that, because it made it in to the newest version of our Diagnostic and Statistical Manual 5. It was not in there prior. They've been aware of it and whatnot prior. It might have been called different things, but it was new.
We really see it as a precursor to like bipolar disorder in children. So I think that's a lot of where that comes from too, is that we don't want to overdiagnose at an early age. But anyway, moving on.
Well, yeah, no, I think that's important. Let me see. Let me back up. Before we go into that, I just want to say a little bit about, how does all of this affect just basic diagnosing and diagnosis in mental health? It's an unknown source, but I thought this was cool. Dr. Google again, right? The source doesn't matter, because the general idea is what I was after. Studies show that women with anxiety disorder or substance use disorder are more likely to have shorter menstrual cycles. I was like, wow, really? Shorter than 24 days. Irregular cycles are also linked to eating disorders and depression, and women with bipolar disorder are also twice as more likely to have irregular periods. Now, again, the science facts there is not the point. I think we're really layering into making people aware that these processes are something to be mindful about in your body, so that you can help the doctors figure out what the heck's going on.
Yeah. How interesting is it?
Right?
That you've been able to kind of rudimentally come up with that research just from poking around on Google, right? And looking up different things for your own research. But the truth is I wonder how many times have things either gone overdiagnosed or underdiagnosed, when really it was the regulation of the menstrual cycle that we probably could have started with.
Yeah.
And then made determinations about the mental health complications surrounding that. You would not believe how many people, well, you probably would, but how many women I've worked with that once we got the cycle regulated, that the anxiety is absolved,
right,
or the depressive symptoms have diminished or are at a more manageable level than they've ever been in their whole entire life.
Right.
But we don't recognize it as that's the issue. We want to talk so much about the symptomology and giving it a label that we forget that there are other medical processes going on at the same time.
It does drive me a little bit nuts that's why I've been talking about the tale of two tapes for a while. You know, that clinicians tend, so young clinicians out there, I think that we have listened to our show, absolutely, like pay attention to the medical realities here that we're talking about. Like that's driving. I mean, I love systems theory. I love cognitive behavioral therapy. Everybody knows what that is, you know. I mean, I love the looking at even some Freudian stuff a little bit. You know, some stuff is really cool there. You know, Skinner, B.F. Skinner. You know, I mean, all these names of people from Psycho 101. It's great. Adlerian. Oh, that's a good one.
Yeah.
You know, but if you just look at your menstrual cycle, or just look at your thyroid, get your thyroid gland, you know, treated and managed, you're in a sweet spot. You feel 10 times better.
Yeah.
But we just don't pay attention to that. And then we do inner child work instead. Talk about our moms, which is good stuff. I'm not downing any of that. All that's great. That's my side of the fence, actually. I can't do anything about, well, I can't do very little about the other side. But incidentally, in my brain, like I said, I've thought about the medical thing for a while in the tale of two tapes and really talk about exercise and, you know, the biological part. Do you find that clinicians do that, or am I off here a little bit?
No, I think the vast majority of clinicians, if they're staying up on the most current research, would be doing that or implementing that into practice.
Good.
Hopefully.
Yeah. Hopefully. Yeah. Okay, good. Disruptive mood dysregulation disorder. So you've kind of heard of that before.
Oh, yeah.
Okay.
I've seen it.
I had to look it up. Let me see. The main points on this article was pretty cool. Let me see. The core characteristics: chronic and severe and persistent irritability.
Yeah.
That's what I got. What the hell does that mean?
Yeah, like there's just no change in the mood. It's very interesting to see it.
Yeah.
Manifest itself.
Yeah.
There's just no fluctuation in the mood. Like from the time the child wakes up until they go to bed, it's just constant and consistent irritability.
I just get frustrated with the fact that when I'm working with those teens, we used to call them conduct disorder, you know, years ago when I started my career, because I would see these teens all the time, you know, as well. And I agree, you know, probably, you know, thought of them as pre-bipolar.
Sure.
You know, I actually 10, 15 years ago was never afraid of talking about bipolar in kids.
Same.
I actually had a conference and we started at that time to be, you know, okay with saying bipolar, you know, with younger people. And there's specific things that you can look out for, which was just dynamic. But when you're not seeing those specific things with bipolar and you're just seeing pissed off teenagers and that chronicity of it, that it doesn't tell me anything about what's going on with them.
Right.
And I wonder if that is hormone related.
That is so insanely interesting. Let me tell you about this situation. So in working with children in group type settings, right? So I don't know how much you know about my extensive history in mental health.
You've done a lot of kid stuff, really.
I've done a lot of residential work for psychiatric treatment, like rehabilitation facilities. So PRTFs. I used to work as the clinician there and then oversight of the campuses and as the director of residential for 2 of them. And we had a child one time. DMDD was the diagnosis. And I would go and do observations in the home, talk to the therapist.
When was this?
All of this. 2014.
Okay, right when right when it came out.
Right. Yeah. In fact, it was like the newest thing that had come out, right?
Right.
Outside of grouping Asperger's back under the autism spectrum disorder umbrella, right? So within that, I would do observations. And so I was observing a child one time that had the diagnosis, and I'm like, something is off here. And then what I noticed was she was asking to go to the restroom a lot.
Interesting.
And then she was filling her cup up a lot with water. So I went to the nurse and I said, do you think it's possible that this child has diabetes? And the nurse said, oh, God, no. Like, she's just like upset and worked up and whatever and whatever. And I said, okay. So then I went to the medical director because I was not happy with the nurse's answer.
Not satisfied, and I'm sure you're persistent.
Right. I was very persistent. And I went and asked the medical director, and she said, I'm going to order a lab. Like, let's just order a lab and see. That child's sugar was 533.
Oh, my God.
So when you ask, could it have been a hormonal problem?
Right.
Absolutely. Her endocrine system, her pancreas was shutting down.
Right.
Yeah. Now, I'm not saying that fixed every behavior that this child had.
Right.
But could you imagine the level of agitation you have in your body if it feels like it's on fire because your sugar is through the roof?
Right.
And so I do think that there's a lot of lineage between what is going on medically and what the mental health presentation is of a kid.
Perfect. Nicely done.
Yeah.
Nicely done. And thank you for caring. You know, that little kid you did her a solid.
Yeah.
Really, you did her a solid to look beyond the veil of what you see in front of you to figure out the puzzle pieces. That's actually what I like about our job the most.
Yeah, for sure.
Honestly.
Yeah.
You know.
It's like investigative research.
It really
great.
is.
Yeah.
It really is. Yeah, it's fun.
So good.
And when you nail something like that, when you
Right.
see something that people haven't seen and that you can then get addressed.
Right. And then once it's addressed, a lot of the other stuff starts to being able to be cleared up. And so that child went on to become adopted into foster care. Like it was awesome.
Yeah. I see the same thing with a kissing cousin, I believe. Right? Premenstrual dysphoric disorder. You ever hear that one?
Oh, yeah.
Right?
Yeah.
Again, another one that's new in the DSM. I don't know why I caught, PDD and missed the whole DMDD, but I just did. I honestly, I can't answer that why. To be honest, I know why. I just figured that out in my head. I just haven't seen a lot of teens. I really, in the last 5 to 6, 10 years, maybe, for whatever reason, my percentage has gone down.
Yeah.
That's what happened.
Well, and DMDD is honestly for younger children. So usually, like you said, as they get older, we'll look at ODD, conduct disorder. But prior to that,
oh, really?
Because of the age of limitations in the DSM, yeah, they give DMDD.
What's the limitation age?
I think DMDD is until like 9 or 10 years old, and then you're going to reassess for like ADHD, conduct disorder, ODD.
Got you. Yeah, because I see, I'll go down to age 6, and I enjoy working with those kids, but I do not see a lot of the younger kids. Well, that's what happened then.
Sure, yeah.
All right, we figured that puzzle out. But I have seen a lot of the premenstrual dysphoric disorder. I wouldn't say a lot, but I think I've nailed it with some people.
Sure.
And if you can't understand that hormones are affecting that, like, I don't understand that. So, real brief, what we're talking about with premenstrual dysphoric disorder, which is interesting that I, as a therapist, am really expected to be able to diagnose these things, right? Like,
sure,
right? That should be, well, it should be all of us, I guess. I stand corrected, but the menstrual cycle's at least 5 symptoms must be present in the final week before onset of menses and start to improve within a few days, right?
Right.
One or more of the following symptoms must be present. Basically, the stuff that you understand with periods. One or more of the following symptoms must additionally be present to reach a total of 5 when the combined set is together. So basically, you're looking at a combined set of I like to dumb it down. Like, this is a terrible menstrual cycle, essentially, that lasts 2.5 or 3 weeks. You got one good week, Case.
Right.
You got one good week where your hormones aren't all fluctuating.
And probably not all 7 of those days are good.
Right.
To be fair.
It has been transformational when I have had those lengthy conversations, and this one is pretty much just obviously women. This is not a dude thing. Although probably men have it, we just haven't identified it. So
thank you.
I wonder. I don't know what it would present as.
You don't have the period symptoms, but you have the others.
What do you mean?
So I mean, like, obviously you're not shedding the lining of your uterus because you don't have a uterus. But I do think that there are periods of time throughout a month or two, out of every year or every quarter of the year, where the male body goes through hormonal shifts and changes, and it's coupled with depression, anxiety, anxious mood, things like that.
Well, it's daily processing.
Correct.
And monthly processing.
Thank you.
And yeah, you're probably correct in some sort of major,
right.
I don't know.
It's just that our uterus sheds its lining at the same time. That's basically the difference.
Basically the difference. We did a whole show on borderline personality disorder last week. And I want to refer the listener to that because I think that as we gave a really good descriptor of all of that, my suspicion is that hormones are absolutely in the center of that diagnostic issue. You ever thought of that before?
Yeah.
Yeah.
Not like that, not explicitly, but I definitely, when I said yeah, what I really mean was I can definitely see it. I don't think I've ever really thought through or processed it in that way, but I can definitely see it, like as you were saying that.
You know, I gave the metaphor of a big body of water flushing down a hill that I learned from a colleague of mine when we were talking about that last week.
Yeah.
And the reality of that big body of water being emotion. I mean, there is a reason why I would love to hook up a very clear borderline person to some sort of hormone monitoring through the day. And I think you would freaking be blazingly amazed. Blazingly. Talk about cortisone shots. I mean, just through the roof. The adrenal gland just zipping constantly. And then shutting down and then just being like chill. Nothing's
Cutting
going
it
on.
off.
Yep.
Yeah.
Fine. Nothing to see here.
Insulin fluctuations, all of that.
Right. I think I get all you geeky researchers people out there, I love you. Please go look at this stuff because this is just my theory of how this works.
Yeah.
And I think it's absolutely the genesis of these particular ones that I've brought out here today. Here's basically my big point. Okay, as we come in to figuring out how to manage these things. Insight is most important, right? Because look, if you suspect your body is doing something, then you can look out for it and you can understand it, and then guess what? You're not likely to do. Blame other people.
Yeah.
Right?
Imagine that.
Right? Because when you're feeling something as a response, it's clearly because of those blue lights. Well, in a lot of instances in our relationships, no, he just took the garbage out. That's all. His ear just moved in a particular way. When you get triggering, when you get your emotions all fluxed up and whatever goes on in your perception of life experiences in the present day or whatever you might be perceiving or experiencing or going on. Like if you're insightful that I'm actually in the middle of my menstrual cycle, or if you're insightful that, hey, I'm in midlife, I'm a dude and my body has changed and I'm balding, that means there's something going on with my body and that might have to do with the way I'm depressed. Then if you could be insightful about that, then you begin to avoid the dangers of throwing it on the outside world. What do you think about that?
Oh, I love that. I think every time I have a session, I ask my clients, is what you experienced based on facts or feelings?
Yes, guy. I've heard you say that before.
Yeah. And I think it's kind of a Socratic question, right? But I think it makes a lot of sense. And when you think through, like I woke up this morning and I'm starting to feel X, Y, and Z, what are the facts? If the facts are that there have been changes within your body, like the medical workings, the biological workings of your body, that is something to work through and talk through. But if it's just based on pure feelings, then that's something else to work through and talk through. But is it facts or feelings based? Like what is going on? What is the reality of the situation? It can't go without saying that, even getting back to PMDD a little bit, right? Like if 11 to 13% of people have irregular menstrual cycles anyway before the age of 40.
That's a lot.
Right. 11 to 13% of people before the age of 40 have irregular menstrual cycles, yet only 5% will ever be diagnosed with PMDD. How is that even possible? Like, the research doesn't make sense. But then when you look at for people between the ages of 40 and 50, that jumps up to 24% prior to menopause. So the possibility that these extreme hormonal shifts have happened and the possibility that those hormonal shifts are leading to some type of depressed or anxious mood is highly likely. Because when you couple that with thinking through 1 in 4 people having a diagnosable mental health condition that's reported, right?
Right.
Another
big number.
The cross-sectional research would say you are all over what needs to be understood about hormones and the way they affect mental health.
Just look at hair loss. I just looked this up, and I'm going to appear stupid for a second, but, androgens such as testosterone. Oh, I got that one, Kasie. That's easy.
Hormones.
T. Dihydrotestosterone.
DHT.
Right. And their prohormones. Dihydro...
Go for it.
Huh?
I said go for it.
I'm working. Dihydroepiandrosterone sulfate. How's that?
I loved it.
Right.
That was pretty good. Like hooked on phonics.
And androstenedione, A. These are the key factors in terminal hair growth. Listen, if you've got a hair growth beginning to become an issue, what does androstenedione do otherwise in the body? I'd like to know, right?
I hope that's not a real question because I don't know the answer.
It's not a real question
Okay.
for you, but it's a real question I have. And again, I'm not trying to make this a medical show. I'm trying to say, like, if this is going on for you, then develop some insight about what's happening and have an awareness of what else that might be connected to. Because I guarantee you it's probably related to things. Hear the S, things, plural. They can't not. It's so interrelated.
So basically, check yourself before you wreck yourself.
You can. This is why I love Kasie. Yes, you can. That is right down to it. And other people.
And other people.
Right?
Yeah.
Your wife. I went gender opposite that way.
Thank you.
Right? You're welcome for that. You're welcome for that. Okay, we cannot do a show about. I didn't even give my qualification. If anybody's listening to this who knows me, I am not talking about my wife for this show, this entire show at all. Can I make that clear enough?
Yes.
Right. Menopause is got to be mentioned because I have, along with, premenstrual dysphoric disorder, and, I've had that theory about bipolar or borderline. See, I still switch it all up sometimes in vernacular. I've had that theory with borderline personality disorder for a while, and I began to become aware of the facts of menopause. I would venture to guess in midlife for men, just as much for women. Every time I say that, do you see her face, Neil? She's like...
I just throw a wink in that direction like, you got it.
Right.
Hey, boy.
This is a dramatic impact on all these systems. All. And it's called aging, Like, I would venture to guess not daggone one of them is left out of major changes in fluctuation. Hundreds of hormones with hundreds of subsets of each one of those. Give yourselves a break, right?
Yeah.
Like, understand that you're managing, you're moving through life, and you get to this midlife section. I mean, everyone talks about a midlife crisis. It's tough, and it is dramatic. As you say, you're moving into aging parents, where you're also moving into teenage years. You're also moving into, it's just so much. What is your take on that stage of life and the impact of mental health? I mean, I'm trying to lay out pay attention to this.
Yeah. I mean, I think mental health is everything in that stage of life. But I think what's interesting is I can't tell you the last time I went to the gynecologist and saw a therapist working at that office.
Oh my God! Don't even get me started.
Right.
Yeah.
Or when was the last time you went in and talked about?
And I've done
right.
well.
But I'm saying, like, when was the last time you went to talk to your doctor about low T or performance issues, things like that, and a mental health clinician came in and talked to you about how you felt about yourself?
Right.
The answer is probably never.
No.
And
we have a men's clinic. They have great commercials in the local area.
Right.
And I think that it's getting more up to speed for men, but I'd give you $1,000 if there was a clinician came to speak to that dude.
Oh, yeah. And there's hundreds of thousands of dollars that are pumped in every year for fertility issues, which is greatly appreciated by everyone. But the truth is that the gynecological world and mental health, they coexist, and we really need them to be integrated. And I think that that's something that continues to need to get more traction so that can happen more frequently. But I think, we talk a lot about fertility and infertility, but then it's like, once you turn 40, once you turn 45 and you approach menopause, it's like, well, take some estrogen and you'll be fine.
That's it. Out the door.
That's not the case. You are not fine. And so the first piece of advice, which I think gets overplayed a lot, is it's okay not to be okay.
Right.
And that is something that, as women particularly, I can't speak for all men, but for women particularly, that is something that we hold on to our pride for so long, because it is expected a lot that we are okay, because when we have families and we have husbands and we have kids, we are expected to be okay. We are expected to be the positive one, the nurturing one, the huggy one. And when you're in those periods of time and you're sweating and you have no explanation about all the night terrors, night sweats, irritable mood, everything that you're going through, the last thing you want to do is be the huggy one.
Right.
But you're expected to be the huggy one, and you're expected to be okay with it. And the truth is it is literally okay not to be okay. But what's not okay is when we hold it on inside and we don't talk about it. And I think that's what it's kind of projected for us to do. Don't talk about it. Take your estrogen, go home and be fine. And it's just not fine.
You know, I have been amazed at how many times I have helped women understand that they're in the menopause cycle. And after I have the conversation with them, they're like, God, you know more. I've learned more about that here than I have anywhere else, in my gynecology office included. Mm-hmm. And I'm just like kind of appalled that that's the case. Like, I should not be able to have that conversation with a woman, but I do multiple times. You know, and just so you know, I've kind of learned that the average age is 52, and that's the medical moment of menopause. That is when you have had no menstrual cycle for 12 months. But then 7 to 8 years prior to that process, 7 to 8 years, your body goes through a major metamorphosis. So that's about what? 42, 43, 44 years old. And you go into the gynecologist and they tell you you're fine, just exactly like you said. Mm-hmm. And it's already begun. I've gotten out these conversations and people go back to their gynecologist and their gynecologist is still telling them, you know, I'm not, Chris. That's what they said. And you know what the client tells me? And I know they're full of it.
Yeah.
And I'm like, yes, we've accomplished the goal. Insight into what's going on, at least paying attention so that you can then begin to manage it and be kind to yourself.
Yeah. And what we don't pay attention to is the things that kind of go into that. So like even at my age at 38, not to be like full disclosure, I did have a birthday last week, but 38.
Decade, by the way. Holy crap.
Mm-hmm. I know.
Yeah. Brutish. But, dang, man. You should see that. We had the YouTube would have seen this look and that was a look.
But you know, there's so many diagnoses in the world of gynecological health. And so I think, you know, when you're a young person, you get diagnosed with like PCOS, things like that. What they don't tell you is that your ability to go into perimenopause or premenopause prior to the age of medical menopause is exponentially higher. And then if you have kids on top of that, exponentially higher. Not one person has ever said that to me.
And that's new to me again. Say all that again.
So if you have like a pre-existing condition like PCOS, if you're overweight.
PCOS is?
Oh, polycystic ovarian syndrome.
Right.
So if you have polycystic tissue, fibroids, other things that are involved with your uterus, endometriosis, all of those things, and you also have kids, and so I've had 2 children, what they have never, not one person has ever told me that the likelihood is going to be higher for me to go into menopause early. But the truth is, because I know from doing my own research and talking to other medical professionals.
And paying attention.
It is a higher likelihood that I am going to go into that cycle early. And all of my hormone markers are now off. Things like that. But if you don't pay attention to it, if you don't look into it, if you don't know to look into it.
Then that's the thing.
It just happens upon you. And then you're told to take estrogen and go home and be fine.
And you feel crazy.
And you feel nuts.
Men, by the way, at age 40, you begin to lose 1% of testosterone production per year. So we go through it too. Yeah. It's just not just dramatic and like, you know, boom, bang, bang, you know, hit me now in a decade. It's like throughout, you know, a longer stretched out sort of period of time. Thankfully, we can adjust. You know, I do. Women don't have a lot of time.
You just buy a car or something.
It's like all now. I know, right? Yeah. Or a Jeep. Yes.
Just go buy a Jeep.
And take the wheels off or the doors off and drive around in the hormone. You know, my Jeep got rained on yesterday.
Oh, I'm so sorry for you.
That sucked, man. And then I had to drive and pick up my kid in a wet seat.
Oh, man. My Buick has french fries in the back. I'm in that stage of life.
So we are winding down here. This has been fun, Kasie. I'm going to look forward to having you on the show. I forget what month it is.
It's September.
September. There you go. How would you sum us up? What are you thinking? Anything that you think people need to know? Like anything more particularly? I'm curious of your thoughts of what do you do about this?
Yeah. I mean, first and foremost, know yourself. If you feel like something is off of baseline, do yourself a favor and get it checked out. And if you don't feel like checking it out yourself, pass it by a friend, pass it by a professional and say, hey, do you think this is normal? Do you think what I'm experiencing is actually pretty typical, or does it seem pretty atypical? And if they look at you and say, girl, what's your problem? Or sir, go get some help, then do it. Because the best predictor of kind of future self-behavior is past behavior. So if you do nothing, nothing changes if nothing changes. So if you want to take command of your health and command of your mental health, inventory yourself, ask a friend, and go get the help that you need.
And that's awesome. Men as well as women. Absolutely.
Yeah.
Yeah. I hope this has been helpful. You know, and I apologize for kind of the theory base on it, but that's kind of what we do is, you know, when we're figuring things out in our field and things that we don't know, we have conversations like these, you know, to, as we say, you know, let's figure this thing out together, because this is definitely a big part of the human emotional experience. Guys, Kasie, thanks for joining us. She'll be back at some time. We will see you guys all coming up next week. Take care.